Goody and I'm a paediatric doctor in London. I'm one of the lucky ones. COVID-19 doesn't tend to affect children anywhere near as severely as it does adults, and so I haven't yet faced the intensity of cases that my colleagues in adult medicine have. In this hospital, the sickest children who are in paediatric intensive care are being moved to another hospital in order to make space for adult COVID patients. And we're being asked to suspend normal life to be on call on a military-style rota. Now, there's a huge amount of anxiety amongst my colleagues right across the country for many reasons. The NHS is about to be flooded with a tsunami of really sick COVID patients that we do not have the capacity to deal with. And there is still a huge amount of confusion around the use and availability of PPE. And then we're also going to be asked to work outside of our competence. If you heard some of the reports that I'm getting from my colleagues who are treating adult COVID patients, you would be both heartbroken and absolutely appalled. I'll read you just a couple of the comments I've been getting. I feel lost and vulnerable. The hospitals in London are overwhelmed. There is still a serious shortage of PPE. We've just been told to close our eyes when any patient coughs. We feel completely helpless. And this last comment, forget lockdown, the NHS is going into meltdown. The managers on the ground are desperately trying to make sure that they can provide a safe service for both the staff and the patients. But what I'm hearing is that there is a massive lack of clarity and guidance from higher levels in the NHS about how to deal with this crisis best. Fragmentation in the NHS is making it virtually impossible to have a strong, coordinated response to this crisis. And if we do get sick, as a result of that and through inadequate protection, then we are leaving this service open to being even more overwhelmed. My heart swells with pride to work in the NHS. My colleagues go above and beyond for the people of this country every single day, and we will continue to do so through the coming weeks. But it just doesn't seem fair that we are now being asked to pay the price for failures elsewhere in the system.